And the saddest thing was that at 18 years old, she had already been diagnosed HIV positive. Hi guys, welcome back to my YouTube channel. I'm so glad to be back. And today we want to know why wait? Why are we insisting on virginity and why do we want to wait? Last time we ended our video on that self-discipline in before marriage is an advantage in marriage. So here are a few things or a few reasons why it's important to wait. So waiting till marriage, you're telling your partner that hey love, here I am as a gift that is still wrapped and ready for you. Imagine what an amazing thing to actually tell someone that here I am, I've not been deflowered yet, but I am a gift still wrapped for you. So waiting is indeed a gift to your bride or to your groom. So I want to encourage us all again to wait till marriage. So here is why waiting is an advantage in marriage. So virgins have peace. This is prior to marriage. So in marriage you have peace, that then there is no fear of STIs, sexually transmitted infections. There is no fear of pregnancy. Just imagine. And there's also no fear of wrong sexual foundations and all that. You get? Because in the present day, what is happening as premarital sex is highly being campaigned for in different ways via social media, on TV, and wherever. You find that if anyone engages in premarital sex, there is the fear of, what if I contract any sexually transmitted infection? What if there are many what ifs? What if alikuwa na, what is it called? So let me actually narrate. You see, back to context. So remember, my background is in the medical field, and one time I was, not I really, but a friend of mine was like cannulating a patient, and you see this person had really accepted their status. Now this person alimwambia, Buddha, uchunge damu yangu ni ya chuma. Ati damu yangu ni ya chuma. Damu ya chuma? Like, what was that? So that person was just basically saying that they were HIV positive. So I'm trying to say that you live with a lot of peace. You're not afraid of, now as I was saying, sexually transmitted infections, and also in this case HIV and AIDS. The other bit is pregnancy. Many people, as they engage in premarital sex, they tend to want to prevent pregnancy, but they are not aware of all other vices that may come with premarital sex. That is the diseases we are talking about. Also, not engaging in premarital sex, one will say it prevents you from STIs, pregnancy, that you have peace. The other bit is waiting and now having sex in the context of marriage. It prevents guilt. Because for sure, having known that you're not supposed to engage in sex before marriage, in some way, guilt shall come in. But when you do it in the context of marriage, there is no guilt. There is no fear of STIs. There is no fear of pregnancy, because you're really anticipating to, in fact, even get a baby and fill the earth as God commanded. So someone shared that sex is ring bound. It's supposed to happen in the confines of marriage. So guys, allow me give you this is like two stories from my experience. As we've talked about fear of pregnancy premaritally, that is in premarital sex, This is a very sad story. So one time I was working somewhere, and I remember it was about the KCSE season. KCSE. KCSE is the exams that are done here in Kenya for you to to qualify qualify from secondary now into campus or whatever. So I recall this dear girl. She came into the hospital and was actually expectant. And this time I was working in maternity, and she was almost due and had to take her exams from the hospital. So she would labor, and then like through the process of labor, the guard was there. And I remember after she was able to deliver, now going forward, the exams were delivered to her in hospital for her to take her exams from there. So I recall me getting to learn about her story, and it broke my heart, because she was barely 18, or she was just getting to 18 years old. And as an 18-year-old, that's when you're termed legal or as an adult here in Kenya. So I recall just going through her records. She's in high school, she's in Form 4, she's sitting her exam, she's pregnant, and she just delivered a baby boy. And the saddest thing was that at 18 years old, she had already been diagnosed HIV positive. And it's not that she was born with it, no, but she discovered that she was HIV positive in her second trimester of pregnancy. And it really, like, it tore my heart. It ripped my heart wide. And just getting to even hear the story. So you see, you're in high school, you're absorbing the shock of, hiya, I am pregnant. You're not even barely over that I am pregnant. And then when you begin your clinical visits, those antenatal clinic visits, you then discover you're not only pregnant, but again, you're beginning a new journey of being every day of your life on medication. So I don't know. I really don't know how to handle that. So it means the person that got her pregnant was most likely the one that infected her, because HIV, say today if you engaged or if you came into contact with a person who's HIV positive sexually or even in any other way, when we test you, the person who's you knowing that you're negative, you'll not immediately turn HIV positive there and then, but there's usually a phase of a 3-month period that we call the latent phase or something. I need to confirm the name, but it's just that dormant period when the virus has not begun replicating. And if we tested you today and you're not sure of your HIV status, we normally tell you, guys, forgive the dogs in my hood, we normally tell you, kindly come back for a retest after 3 months, because after 3 months is when the virus will have replicated all over your body, and now the test will show it's positive. So remember, I said that she realized she was HIV positive in the second trimester of her pregnancy, that is after 3 months. So definitely in the first 3 months, she never knew that the person that she slept with was or the person that got her pregnant was HIV positive. So, and then now testing her, because even she did not even go for a retest in the first month and all that, in the first trimester. So when she began her clinics, then she's past 3 months pregnant and then gets tested and turns positive. So let me continue a little bit on this HIV process, or this how HIV replicates in your body. So today, if you engaged with someone who is HIV positive, or who you're not sure of their status, and I'm not telling you to go and engage with someone just randomly or anyhow, we normally have something we call post-exposure prophylaxis. So if our dear girl knew that the person that got her pregnant was HIV positive on the go, we would have recommended for her to immediately go and begin the post-exposure prophylaxis. These are medicine, or the first thing is that for you, if you engaged with someone who's HIV positive, maybe last night, you should begin your post-exposure prophylaxis immediately, or if not immediately, before the elapse, or before 24 hours elapse. Are you getting? Because now we've turned this to a class. So you should always start your post-exposure prophylaxis treatment. This is post, before 24 hours elapse. So, and you take this medicine for a period of 1 month, and after that you get a retest. So if our dear girl knew that this person was HIV positive, we would have recommended that she gets the post-exposure prophylaxis, and then would retest her. And with that, it really attacks the virus and keep it at bay completely. And she would have at least gotten the baby, which is a blessing, and enjoyed a HIV negative free life. So that's one story that I've come across in my career, and emphasizing on the need of just wait till marriage, and don't go out, don't go sleeping with every Tom, Dick and Harry, because you do not know their status. So time for another story. Forgive the dogs in my hood. Again, I was working somewhere in just a small clinic, medical clinic, and around or within the vicinity, I realized there was a campus. There was quite many universities around, and with universities, a lot tends to happen, especially in matters sexuality and sexual purity. So this one, as I give this story, I want to reach out to you, my dear girl, who's listening or who's tuned in, because I got to really learn a lot. So usually we used to work on weekends, that is on Saturdays, and I remember Saturdays, yani we used to have a lot of young men coming in, young men in campus. They're in first year or second year, third year, fourth year, or who knows what level of education they are in, but for sure they were in campus. So this one day, a gentleman walks in, and he is sweating from, like, his forehead is almost dripping sweat. So he gives his story that he engaged with someone who or he came into contact with someone who he wasn't sure of his status and all that. So we got to help him with the post-exposure prophylaxis and all that. And again, another gentleman came also, and he was also like really concerned. He's on the go, he's afraid. He wanted to get tested and check his status, but again he was quite unsure, or with just the anxiety, like what if it turns out positive. So may this reach you, my dear girl who's in campus, or my dear sister, you're in a university, or you just cleared your Form 4, whatever level of education you are. I came to realize that these young men, they really love themselves, honestly. That's how I'd phrase it in short. That these young men, they really love themselves. Absolutely, they love themselves. They care about their status, you know. And I'm calling you out, my dear girl. Do not be careless. Even if you came into contact with someone, don't just overlook it, but know that this person really cares about their own status. Because the rate at which young men, and I'm saying men like a man, a boy, a gentleman, sorry, a gentleman, okay, should we call them gentlemen? I don't know. A gentleman is a man who waits till marriage. Yes, it's the true measure of masculinity. So these men really walked in and they were like really want to check their status, and they want to begin their post exposure prophylaxis in care or in pursuit that they do not get STIs or sexually transmitted infections. So, my dear girls, and also my dear gentlemen, do not be careless. You do not know the HIV status of this lady or this man that you're probably going to engage in sexually. So, again, this is a call out to all of us. Let's wait. Let's wait till marriage. It is worth it and it pays. It takes away all the fear, all the pain, all the fear, all the guilt, all the fear of pregnancy that you tend to prevent pregnancy. But again, you're not preventing the place of guilt and all that, or the STIs. So in marriage, it allows you to be STI free because both of you are faithful, or you intend to be faithful, and so does your partner. And also pregnancy, you're actually looking forward to getting pregnant because I shared you want to feel the earth, and you're also guilt free because you got married in the witness of God and man. So that's my encouragement for you today. Next time I'll talk about HIV and the post-exposure prophylaxis and how all that works. So share this video, let it reach a brother or a sister, and see you in my next video. Ciao. Mwah.